So I'll often see patients at various stages in their journey towards getting better. I may see them pre-surgically, where they've gone in, it's a routine check, they mention, oh, I've been having this issue with incontinence, I wonder if there's anything that I can do. They may go home with a handout from their physician, do your Kegel exercises, or they may not. They may say, you know what, I hate this problem, I can't wait till I get stronger, I need to have it fixed right now. Those are the kind of patients that it's great to see them for one visit beforehand, make sure that they at least have a concept of what's going on. They go off, they have the surgery, letting them know that there are options for after, because even if something's been surgically repaired, the anatomy has been restored, you still have to have good support, which comes from your muscles. You have to have good functional use, which comes from using your muscles correctly and in a coordinated fashion so that A, you protect the surgical repair, and B, you can help it last for a lifetime. So those are the kind of things that we can do beforehand. Many patients come to me with very significant anatomical issues. I may be seeing patients for symptoms of prolapse where they're very uncomfortable. It's a pretty significant issue that is definitely surgical, but they can control their symptoms well enough so that they feel like they can either eliminate the need for surgery or that they can significantly delay it. And so, you know, there are options in that regard. There are many patients that I've seen who've had multiple surgeries beforehand. Maybe the surgery that they had long ago failed, or maybe the surgery itself is fine, but because they're starting to lose strength and coordination, the surgery that they had for maybe a stress incontinence issue, on leakage with coughing, sneezing, lifting, has now become more of an urgency and frequency issue, and so they can't travel. So we teach them all kinds of techniques to help control that mind over bladder situation, and we also help to improve their strength, because without pelvic floor strength you still can't control your bladder. So there are a lot of things that we can do after that. Typically patients who are considering surgery for pain, I absolutely hope that they can come in at least for an assessment before they choose to have surgery, especially if you're considering a hysterectomy or anything that you might have a regret for at some point. We certainly can't cure endometriosis. We can't cure pelvic inflammatory disease, but there are a lot of muscular issues that go along with being in pain, postural dysfunctions that go along with being in pain, loss of flexibility, loss of connective tissue flexibility, so your organs, because you're in pain and all curled in a ball when you're always protecting yourself. You know, everything gets a little tight and immovable and short, and if you can just free up some of that, sometimes it makes a world of difference. So it's always nice to at least have that consult and that consideration of, you know, what might be helpful.